We're helping patients, caregivers transition between healthcare settings with the goal of helping them feel more empowered, be able to self-manage themselves at home, and also to prevent avoidable readmissions to the hospital.
What happened in the past was they would wait till they got into crisis and would present to emergency departments. Physicians didn't have the time or the resources, again, to manage them. So again, each episode was kind of treated as a new beginning. And what happened was there was a lot of duplication, a lot of redundancy, and quite honestly frustration among the patients themselves because we weren't connecting the dots as healthcare providers.
When you look at readmission data, one of the highest diagnoses of readmission is congestive heart failure, and we're a top 100 cardiac hospital, so it seemed like the next logical transition to make and to look at how we can reduce the readmissions with that population, and that's why we began working with Dr. Walensky and Kathy Daly, and we formed the pilot.
What we learned is that the treatment doesn't end at the time of discharge, but really just begins. That what happens to the patients in the first 2 weeks after discharge is key.
About 50% of patients, the research shows, do not have a follow-up physician appointment 7 to 14 days post-discharge. So they're coming out of the acute care setting with lots of issues, perhaps some laboratory studies that need to be followed up on, changes in medications, and there's no one out there to help them coordinate that care during that time frame to 7 to 14 days.
If we can keep the patients well and out of the hospital for the first 2 weeks after discharge, then we'll be able to be much more likely to keep them out of the hospital long term, and that probably converts to better survival.
Say you're a high-risk heart failure patient that's come in through the emergency room. I look at all your labs, I look at how you feel and how long you've been a cardiac patient and what kind of heart failure you are. And then I stratify you into the program. So then I follow you up to your patient's room. I do education with you.
I was amazed at how much I didn't know about hearts and what can go wrong and what has to be done to make them beat better.
I follow you throughout every day of your hospitalization, and also will make home care visits should we need to.
It's really a support to the primary care physicians within the community, whether it be primary care physician or the cardiologist, because that advocate, that coach is helping coordinate the care for those patients, helping and communicating with the physician on changes that are happening to those patients when they're home. Information that that physician may not necessarily have if there wasn't that advocate or that coach there to be checking on the patient, making sure that they're doing what they're supposed to be doing at home, that they're weighing themselves, they're taking their medications, and they're following up with their primary care physician.
Over a period of 6 months, looking at the data of the Transitional Heart Failure Program, we see that our length of stay, our mortality rate, and our readmission rate has gone down drastically from 2008.
The journey really goes to what's called the patient-centered home, and that's the goal of most people who are in the healthcare provider business. I mean, that's really what we want to look at. We want to be able to link patients' care regardless of where it is. It doesn't matter whether the primary care doctor, whether they're at the specialist, whether they're in the emergency room, or whether they're traveling to Brazil. Everybody has access to records. Everybody knows what medicines patients are on and what they're not supposed to be on, so that we cut down errors. We improve the efficacy that we deliver care, but everything's focused on the patient regardless of where he goes.
Because every time I go to my endocrinologist, he tells me that Dr. Walensky said this and Dr. Chang or whoever said this, and they all communicate, and I think that's a very good thing.